I'm Dr. Stephen Cohen, a general internist in suburban Atlanta. I'd like to share with you information about a national, nonprofit educational initiative which can save the older relatives of your customers and employees hundreds to thousands of dollars a year on their Medicare plans. Medicare is the federal program which covers medical care for people 65 and older, as well as people with certain disabilities. Medicare only pays for prescription medicines after you sign up for Medicare D or Medicare Advantage plan. The government helps pay the premiums for these plans, which are offered by insurance companies such as Blue Cross, Aetna, and many others. Two plans may cover the same medicines, but differ in cost by thousands of dollars per year. The video on MedicareDrugSavings.org teaches people how to find a less expensive plan, which covers exactly the same medicines as the more expensive plan. If you can pay $500 to get medicines A and B, why would you pay $2,000 to get the same medicines? In my job as an internist, a physician caring for adults, I've taken care of thousands of adults on Medicare. Unfortunately, I've also seen people on Medicare have trouble paying for their medicines, even if they've had Medicare D prescription drug plans or Medicare Advantage plans which help pay for their medicines. I recently spoke with a woman that I've been seeing for many years as a patient. She tearfully told me that she would be leaving the area. She said that she was not able to pay for the cost of her mortgage, her food, and her medicines. Because of this, she was moving to another state where she would be living with relatives. After hearing this story, I felt it was important to do what I could to help people like her and the families of your customers and employees save hundreds to thousands of dollars a year on their medical expenses. The time when you can change to a new Medicare D or Advantage plan is called the open enrollment period. This year, the open enrollment period is October 15th through December 7th. There are several government agencies, medical organizations, physicians groups, and healthcare systems representing thousands of doctors recommend using this website to help people save on their Medicare plans. Clark Howard, a consumer advocate heard on over 200 radio stations, has featured this initiative on his radio show and website. How much could this type of educational initiative help? In Atlanta, Medicare patients can choose from over 40 possible plans. A study in 2012 showed that only 5% of the Medicare population chose the least expensive plan, and that the average Medicare D patient could save $368 annually by using this tool to find the cheapest available Medicare D plan. Extrapolating the $368 annual savings to the U.S. Medicare population of 46 million people yields an annual savings of $16.9 billion. Federal and state budgets are stressed by increasing healthcare costs. Switching to less expensive plans could potentially reduce government spending by billions of dollars annually with no decrease in the quality of medical care. I hope you find this website to be an educational resource that you and your organization can use to help employees and customers. In addition, it can help your friends and family decrease the cost of their medical expenses. I want to emphasize that the target population for this initiative includes the younger age groups who are not on Medicare. Many of my younger patients have appreciated learning how they can help their older relatives who may not be computer literate save on their medical expenses. You can share this information on your website or by providing your employees and customers a one-page handout which costs 3 cents on a laser printer. Think how someone who receives this and then spends less than an hour to save her two parents $1,000 per year is going to feel about your company. This is an opportunity to do good while you also improve employee morale, increase customer loyalty, and maximize your brand visibility at a minimal cost. You have the option of printing either of two single-page handouts describing how this website can lower medical costs. Look at the two icons above this video. Clicking on the Customer Brochure to Edit brings up a Microsoft Word document, which you can edit to include the name of your company, as well as other information in the text box at the top. This can present your company in a positive light to anyone who sees the handout. One of our patients saw this newsletter and asked if he could have 50 copies to take to his church. Everyone in his congregation who saw this also learned the name of the new physician in our practice. Clicking on Customer Brochure No Edit brings up a PDF document which describes a website but cannot be easily edited. By working together to make medical care more affordable, we can improve the lives of the people in our community.